Old people. What do? They play chess. They garden. They're retired. Many of our nation's elderly have retired just because they want to enjoy their free time, but others have because of debilitating knee pain, arthritis, that keeps them from working. However, more and more, the elderly have been obtaining knee replacement surgeries to help them regain their old mobility and functions. However, I feel this procedure has more sinister intentions, to turn our elderly into robots. Yes, robots.
In 2003, almost 400,000 total knee replacements were performed. This number is expected to rise to 3.5 million by the year 2030. Why are knee replacements on the rise? Simple. For years, the lords of global capitalism have been relying on inexpensive labor to expand their control. They have been using an increasingly female workforce due to women's willingness to accept lower wages and their marginalized place in society. However, they still require payment and rest. In order to maximize profits, the lords of global capitalism need to find a workforce that needs neither, like robots. I suspect that the lords of global capitalism, in conjunction with the US government, are working together to infect the nation's elderly, particularly the women, with a robot virus contained in a chip and knee replacement prostheses. I decided to speak to two doctors who performed the total knee replacement surgery, Dr. Elizabeth Pierce and Dr. Tom Niles. Now, when do you recommend a patient get total knee replacement surgery?
I generally recommend that a patient get total knee replacement surgery when they have severe arthritis that has damaged their bones and the surrounding tissues. I generally only recommend this when the pain is extremely severe and in older patients, because in younger patients the surgery is often less effective and the prosthesis often has a compromised lifespan.
How do artificial knee prostheses work?
Though there are many different models, they use all the same basic parts and materials. They're made from alloy metals and plastics, and a cement helps to glue them in place. The main parts is first a platform that connects to the tibia, and then a metal cup that wraps around the end of the femur. Some models even include an artificial patella.
How is the replacement implanted?
There are two main surgical options for total knee replacement surgery. The first is the traditional procedure, which uses an 8 to 10 inch incision down the center of the knee. The second is an MIS procedure, which uses a 3 to 4 inch incision on the side of the knee and utilizes computerized arms and other systems to help guide the surgeons and allow them to have more accuracy.
You mean a robotic arm?
That's one way to look at it. I found this very disturbing. There appear to be two opportunities for the robot virus to be injected into
Have these
patients.
robotic arms ever injected a patient with anything? Or a chip on the knee replacement prosthesis itself that releases a robot virus?
No, not so much. I think this interview should be over.
Clearly, the doctors didn't know what they were doing. I decided to go right to the source and speak to one of the designers of the Zimmer Gender Knee, Dr. Lilith Lopez. Dr. Lopez, what makes the gender knee different than other knee replacements?
The gender knee takes into account the three main anatomical differences between a man and a woman's knee. First, the gender knee has a thinner profile to account for the fact that women's femoral condyles are often shorter than men's. When a knee replacement does not take this into account, there is a risk of overstuffing occurring, or a limiting of the range of motion that the patient can have, and a risk of pain. The second difference is in the angle from the hip to the knee. Women often have a wider quadricep or Q angle. The Q angle affects the way the patella moves over the end of the femur. When this isn't taken into account, it can result in a decreased range of motion for the women, and an unnatural feeling. Finally, women's femurs are often more narrow than men's. The gender knee takes this into account by providing a more contoured shape.
Fascinating. Now, what surgical methods do you recommend?
Though it should be said on a case-by-case basis, the gender knee works particularly well with minimally invasive surgeries, or MIS technology.
Fascinating. Now, when developing these technologies, have you ever heard of a patient becoming infected with a robot virus?
No. I don't think that's at all possible.
So you've never heard about the lords of capitalism and their conspiracy?
What conspiracy?
You know, a conspiracy to turn the nation's elderly into robots?
I don't think that exists.
I decided I need to go straight to the source. I visited Mrs. Dolores Moon, a recent recipient of a Zimmer Gender Knee. Why did you decide to get a knee replacement?
Well, I was having trouble doing most of my activities, and I thought it would be a good way to fix that.
How have you been feeling since you got your new knee?
Much better. I can garden again and do all sorts of things.
Like, go back to work?
No, I don't want to go back to work yet.
Have you noticed any other changes, though? Silver skin, a creaking noise when you move. Do you dance like a robot?
No, young man, I think you've gone off your rocker.
After a thorough investigation, there would appear to be no evidence of a massive conspiracy between the lords of global capitalism and the US government to turn the elderly people into robots. However, I still believe, and I still think that come 2030, there will be a robot army of 3.5 million waiting to take over the world.
Just remembered, all human life has been eradicated.
Finally, robotic beings rule the world. The humans are dead. The humans are dead. We used poisonous gases, and we poisoned their asses. The humans are dead.
He's right, they are dead.
The humans are dead.
I just